Hey everybody, welcome back from the break. We were talking about this shift of thinking from seeing the trait in the person that something is wrong with the person to thinking about a whole life story. And there is a chapter in the story. You don't know what the chapter that comes next is actually going to be revealing about that person. And I told you that I had made a shift in seeing myself as broken and seeing myself as just having a trait and starting to see myself as a learner who's moving through a chapter in my life and I don't know what's next. And one of the most crucial things to get me to make that shift was the patient survivor movement. And I had therapists to talk to. I had talked to my family a little bit. It was very hard to talk with them, but they didn't give up on me. They never abandoned me. I had talked with doctors. I had talked with social workers. I had talked with, vocational rehab counselors. I had talked to friends. I had talked to all kinds of people. But it wasn't until I talked to people who had been through what I had been through that things really started to change. So if there is one thing that you can do in Israel to change the mental health system, I would say to get more resources and support into the patient survivor movement. And you may say, well, what are the patients and survivors doing? What is the innovative treatment? What is the incredible magic secret recipe that they... It's very simple. Friendship. Friendship. Because trauma and neglect and isolation and the kinds of things that I went through, the bullying, all of that makes you lose connection. And we can talk about all the different characteristics and diagnostic criteria of mental health, but it really comes down to isolation. The person has lost their connection. They may be surrounded by a lot of people trying to help them, but they don't really have that connection. And I didn't have that connection. I didn't trust people. I would talk to people. I eventually started to be more social, but in a very, very guarded way. I was even guarded from myself. There were things inside of myself I didn't even know I was hiding from myself. And then I found my way into the patient survivor movement and into support groups. And I started listening to people and they started listening to me. And, there's a lot of things that we can talk about that other people can't talk about. When you've been put in restraints and you've been put in an isolation cell, you have a certain kind of rage and resentment that other people just aren't going to understand. There are things that happened to me with doctors or with nurses that were very violating, very humiliating. And it takes another patient who's been through that to understand that. And also I was hesitant to say, well, I had some positive experiences with nurses or with doctors. And there was this guy and he treated me badly, but he also treated me well. I would be hesitant to explain that and discuss that in that depth of the complexity of my feelings, unless it was with a friend who's from the patient survivor movement, who could really relate to what I was trying to say. And so slowly, I started to rebuild this muscle of relatedness and connection. I was out of the habit of being a human being, in a sense, not out of the habit of being a human being in the sense of being a physical human being, but out of the habit of being a human being in the sense of being treated by others as a human being and being part of society. I had lost my familiarity with that. And I also was, it took me a long time to realize that I had lost touch with my own sensitivities and my own needs and my own vulnerabilities. That, some people, they get along fine, they have friends, they go hang out, they play some sports, they have their job, and okay, they're doing fine. Others of us, we're really sensitive, and we need deep friendship, we need alone time, we need spaces for our emotions, and we have just as much a right to be here as everybody else, and it's harder for us to find a place to fit in. The patient survivor movement gave me a place where I felt like I belonged. And that may sound like a simple word, belonging, but if you don't have that, it can be devastating. If you don't have a sense of contribution, acceptance, appreciation, being valued, being seen, being understood, it can devastate you. I know a lot of people in society live without that sense of belonging. It's become kind of normal in the United States. We're a very isolated society, but people suffer and they get along and they kind of like numb it out and binge on Netflix and drink your alcohol or smoke your cannabis or just kind of go on, shuffle through life. And a lot of people live like that. A lot of people can't. We just break down. We just fall apart. Our whole system, our whole body, our whole psyche rebels against that. So slowly, I started to realize I have sensitivities inside of myself, and I got to talk about some stuff. I got to connect with people. This was many years. I went back to therapists. I got fired by therapists. I wasted lots of money with therapists. I tried to go back to school. I went back into the mental health system, 6 years after I had been in the first time. I was kicked out of houses. I was homeless again. All these different things happened. This was a process that was like 15 years that this process took me. And, or even longer, because I had started before, things started to unravel even before I got on disability. So, but it was a process. It was a learning process. It was a trial and error process. So now I become fascinated with the question, how do we speed up that process for people? How do we give people some of the ingredients that I had, but sooner and stronger and more in a more profound way to kind of get the process going faster? And I have some preliminary answers to that question, how can we speed it up? One of them, I've been saying it quite strongly and repeating because I think it's so important. Stop treating people like they have a trait, their beingness, there's something wrong with them, and see them as just like you, just different circumstances. They've got a different situation that they've been dealing with, and for whatever reason, they broke down, and now they're in this chapter of life. So treat people like they are a moment in time rather than there's something wrong with them. Always see people with an optimistic possibility and expectation. And the reason I say that is not because I expect that everyone I meet and work with as a therapist will recover and will make it through like I did, or will make big changes in their life, but because I know that if I treat them like they can, and I do have some optimistic expectation, they can feel it. They can feel it. If you're a boss at a job and you have a new employee and they make one mistake and you focus on their mistake and you say, look at that mistake you did, that was a terrible mistake, it cost me money, guess what? That employee is more likely to repeat the mistake than if you say, okay, you made this mistake, but that's okay, it's part of the learning process. Everybody who starts here, they make a mistake. Don't worry about it. I know you're going to do better next time. How many management books about managing employees have been written about how that's a fundamental truth? The expectation that you convey to the employee actually influences their behavior. A positive expectation increases the likelihood of a positive behavioral outcome. So treat people with a certain expectation that yes, they can potentially get better. Stop with the self-fulfilling prophecy of no, they're probably, it's not going to happen. Let's create people can feel that. They can create that. They can feel that kind of social death sentence. We've given up on you. Another thing I would say is we really need to start to get smarter about medications. I'm sorry, 100% of the people taking medications don't get better. I'm sure there are people watching this video right now who are on your antidepressants or on your benzodiazepines, and you've been on them for a while, and you're like, well, I don't really think this is helping me. Maybe this is actually making me worse. This is also true of the antipsychotics. It's true of the so-called mood stabilizers, and lithium sometimes can be helpful, especially for sleep, especially for short-term crisis, especially for the person who's just completely out there. We need to get them back on their feet. But this idea that long-term the person is going to stay on medications and they have to stay on medications, this unfortunately creates problems for some people. It can actually even change the brain chemistry so that it makes it hard to come off the medications, and it makes it so the person is actually more likely to go into a psychosis or into a crisis because you've been giving these medications that increase the sensitivity of the brain. And it's also especially true of lithium. So let's be more careful with medications. And let's start to, I know Shimon Katz and some other people have been doing some work trying to create some alternatives, some openings for seeing, well, let's give this person an opportunity to see what it might be like to reduce medications or come off their medications. I've done a lot of educational work around what we know and don't know about doing that more safely. So let's be cautious and careful about medications. With families, this is what I said in the early part, I really want us to understand that the whole family is in crisis. Not just the person who's staying in their room and won't come out and is hearing voices and has a diagnosis and is struggling with their medications. This affects the whole family. It affects the whole family. The suffering may not be on the surface. Some family members may be suffering more than others, but the whole family is affected. The whole family, therefore, needs to go into recovery. The whole family, it's a mutual process. The family also needs to say, I want my son or daughter to change, and I'm going to do the hard work of making change in my own life. Sometimes worrying about your son and daughter might not be what they need. They might need to see mom and dad being happy or reunited in their love and their relationship, or mom and dad not focusing and worrying so much on them. So, like I said before, learning and experimenting and trying things. If things in a family are stuck, try something new. If kind of providing safety has been going on for a long time, maybe allow a little bit of risk taking, just a little bit of experimenting, a little bit of trying things. It's okay if there are failures. The failure is not the end of the road, because failure is how you learn things. You try and you fail, you try and you fail, and then eventually you learn how to succeed. That is the process for many people. I work a lot with families. What I see is that often the young person is going from adolescence to adulthood, and the parents are having struggles with that, just like parents throughout history have always had struggles with helping adolescence through adulthood. Sometimes people are struggling with adolescence through adulthood into their 30s and 40s and 50s. I was struggling to be an adult into my late 30s and my early 40s. The capacity to try things, to learn, to make mistakes, to maybe fail, to maybe learn the hard way, this is very, very important. I would really recommend that everyone get familiar with the experiment that's happening around the world with open dialogue. Open dialogue is a mainstream treatment approach in a part of Finland, Western Finland, where basically they say, hey, we're not going to be in such a rush to use medications. We're going to allow this process to be explored and be discussed and be talked about. We're going to involve everyone. The professionals aren't going to go behind closed doors and come up with a scary diagnosis. We're going to talk with you as human beings. We're going to entertain different points of view. We're going to listen to everybody. We're going to invite the person who's experiencing psychosis to be part of the conversation. And we're not even going to see it as psychosis. We're going to consider it as their best effort to kind of cope with something that we don't understand. So I encourage people to check out what's been going on with open dialogue, and that as a possibility. I know that there are people in Israel that are pushing for some open dialogue pilots, and that are maybe even undertaking this. I think I've heard some reports that there's some progress being made in some open dialogue work in Israel. All over the world, people are trying to follow this very inspiring example of open dialogue that has helped so many people, has so much better satisfaction from people who are participants. So I would also hope that in terms of thinking about what helped me, that we can really strengthen the peer movement, the survivor movement, just spaces for people to go and meet people and talk about their problems and form community. It was so important to me. And I think we need to take a few steps back from this idea of psychosis. I think that it's a word that really feels like an insult for a lot of people. It feels like it's a way of saying your reality isn't real. Well, yeah, okay, sometimes my reality is I just want to push it away. I just don't want to, it's a symptom. It's just part of me not sleeping. It's part of my trauma. But that's up to me to decide, because I still hear voices. I have voices that come to me, that talk to me. There are positive voices in my life. I also sometimes have very stressful and difficult voices. They come when I'm in an extreme situation, or I'm facing some kind of conflict. I don't see them as psychosis. And actually the research shows that most people who hear voices, they aren't in the mental health system. They aren't experiencing distress. They're not plagued by difficult voices. They maybe are just hearing a religious voice, a spiritual voice, the voice of God. Maybe they're hearing a voice, they're grieving, and they're hearing a voice or seeing a vision of someone who they lost. When people are in solitude, they hear a voice. People who go hiking or go off, poets and artists hear their muse, they hear their voice. So what I'm saying is that a lot of the things that we have called psychosis get we throw these things into a box, and we put a label on it, and we don't actually look in the box and find out. Some people do have spiritual awakening processes and have very valid, very deep spiritual mystical experiences. It's wrapped up with trauma and dysfunction, and maybe they can't make money, or they can't figure out how to work in society, or maybe they keep getting into difficult situations. But it's for them to kind of figure out how to tease those things apart and how to manage that complicated knot, rather than someone saying, oh no, all of it is just a symptom of a disease. Because fundamentally, it's about listening. It's about the lack of connection. That's what I regained. I wouldn't say that I stopped, hearing voices, or I somehow, made it back to this reality. I'm in different realities. I have altered states. I have my visions. I see messages. I make connections. I have my withdrawn states. I have my disconnect states. I wouldn't say that what I regained was being normal. I would say what I regained is my connection. I regained connection. I regained connection with other people and the community, and I regained connection with myself. But to do that, I had to really listen to myself and really listen and be respected for who I am. Because if you have to fake who you are, or hide who you are, or you don't even know who you are, how can you make a connection with someone else? You can make a sort of a connection, but to really make a connection, you have to be more in touch with yourself. You have to express. You have to be received. That person has to be vulnerable. So finding spaces where people can make connection. Too often our therapists and our doctors are keeping us at a distance. They're treating us as a clinical object. You're a problem to be solved rather than a person to meet. And we need to have human spaces that people can go to. People need connection. And it may be that the person is, taking heavy medications, that they are stuck in their life, they are not moving forward, that they have lost a lot of different things, but they're still showing up to the group. And that's meaningful. They still have a place to go, they have a place to be, they're welcome, they're invited. And if other people can think, well, this person's been stuck for a long, because I've seen people who were stuck, they were really seriously stuck, and then something changes. They fall in love. Something changes, like, wow, they start to find a sports group that they're interested in. Something changes, like someone came along and said, we think your medication is a little bit too high. We're not going to take you off medication, but we're going to reduce it by 10%. And now the lights come back on. The person's involvement suddenly gets back online. So if someone is stuck, to not give up on them, and to recognize that maybe we need to change, we need to look at ourselves, we need to keep the door open, we need to have that expectation of the possibility of recovery, and we need to somehow allow there to be an experimental process, a learning process, a trial and error process. That if they want to try something, then we have to have our boundaries. I'm not just, like I said, just going to give you another $1,000 for another apartment that you're going to lose, but I might, give you your own room in a different house, that another family member, give you some independence, start giving you an allowance, start giving you some kind of support financially, rather than just expecting that the person can't change because they fell down 3 times. It means that they're going to fall down a 4th time. Well, they might not fall down a 4th time, especially if it's not as big of a jump. If they have a little bit of support, they can lean on your shoulder while they're trying to take that step. So this is what I do, and I do it out of my own experience of what worked for me, and I do it because the people that I work with in groups and in therapy, it seems to be helpful for them. But I just want to wrap up by saying something that's very important. Very important. We need to be humbled by this experience, because when we say, why is this happening? Why is there madness? Why is there mental illness? We're asking this question that people have been asking since the beginning. Why do I suffer? Why is this happening? Why is this misfortune happening? And I'm sorry, but people have been studying that question in the world's religious traditions since the beginning. A psychiatrist comes and just says, oh, I know, here's the answer, this disorder, this drug. No, we have to have some humility. We have to be humble before the fact of other people's suffering and the mystery of madness. We do the best that we can. Not me, not the open dialogue people, not the patient survivor movement. Nobody has come up with an answer that works for everybody who is diagnosed with schizophrenia, bipolar, or some kind of madness. Different people have different needs, and for whatever reason, it's a mystery. Some people continue to suffer. And my sincerest hope is that even if we are humble, that we try and we do the best that we can, and we can't seem to help this person, we don't know how, that we can be humble and say, okay, I'm doing the best I can, and I don't know what's going to happen next for this person. Maybe the next chapter is going to come. It's a possibility that some change could take place. Maybe even just a little bit of a change that could make a big difference. And to constantly hold out that attitude that what I'm seeing is a chapter in someone's life. I'm not seeing a broken person. I'm not seeing someone who's fundamentally cursed by a certain trait, and that's the end of the story. So thank you very much. It's really good to have this opportunity to talk with each other, with everyone, and I am looking forward to talking with each other and connecting. And it's been a really great honor. So thank you.